How many times when you were little did you fall down, scrape your knee, or bump your head? Probably too many times to count. Now imagine if every single one of those times you had to tie a tourniquet around your arm, disinfect, lay out your tools, infuse yourself with medicine, compress, ice, and hold, and hope that the bleeding stops. This may seem excessive, but this is the life of a child or an adult suffering with hemophilia. I want to talk to you today about the silent bleeding disorder, hemophilia. On August 25th, 2017, my nephew Henry James Tell was born. Everything was perfect until he had a routine procedure done, a circumcision, and the bleeding would not stop. Doctors didn't know what to do, and for fear of the baby losing too much blood, they transfused him and rushed him off to Children's Hospital of Philadelphia. At CHOP, Henry was diagnosed with hemophilia type B severe. He was missing a clotting factor, and he would be for the rest of his life. We also learned that this genetic mutation was caused by the mother's X chromosome. Sometimes it was caused by a spontaneous mutation. But all women should know, because we're at great risk of passing on a mutated X gene to our child, and we don't even know about it. But knowledge is power, and knowing about hemophilia and understanding hemophilia gives a greater probability to better treatments and possibly even a cure someday. So today I want to talk to you about hemophilia, the types of hemophilia, the levels of hemophilia, and the treatment for hemophilia. Now, hemophilia is a rare blood clotting disorder. So rare, in fact, that the CDC only reported 400 births last year affected with hemophilia. That pales in comparison to the 130 million births recorded by UNICEF. The rareness of this disease is also hard for patients suffering to get treatment. Now, Dr. Michelle Rabe writes in her book, Genes and Disease, Hemophilia, that even in the early 1900s, the life expectancy of a hemophiliac was only 13 years old. Thanks to modern medicine and science, hemophilia can have a long life expectancy like the rest of us with treatment. And treatment centers, though, are becoming a little bit more prevalent in larger hospitals, but they're not available in smaller hospitals. And those smaller hospitals are just not equipped to understand and treat hemophilia like it should be. It really takes a specialist. The only way to test for hemophilia is to test the mother's blood and the baby's blood over and over to figure out where that gene came from. And unfortunately, insurance doesn't cover this because the disorder is so rare. The National Hemophilia Foundation states that hemophilia is caused by a mutation in the X chromosome. That mutated X chromosome is missing a factor in blood clotting. Now, in a regular person's blood clotting, there are 12 steps in order for it to clot. Let's picture it like a chain link. Each link has to attach to another one in order for the process to complete. In a regular person's blood, it follows all 12 steps and completes the blood clotting process. In a hemophiliac's, the chain keeps going, but then there's a chain link missing, and the chain can't continue. Essentially, it's broken. So we have discussed how hemophilia is very rare and how not that long ago it was practically a death sentence. And we know how it comes into existence from the mutated X gene. And we know that that mutated X gene is missing a blood clotting factor. And there are two types of hemophilia, and each one is missing a different step of that blood clotting factor. There is type A hemophilia and type B. Type A is missing factor 8, so it's missing that link number 8. Type B hemophilia is missing factor 9. It's missing link 9. So each of those are missing those two factors, and then there are different levels of severity for each one, but they are the same. There's mild, moderate, and severe. In a mild hemophiliac, they create about 5 to 40% of their factor. In a moderate hemophiliac, they create 1 to 5% of their factor. And in a severe hemophiliac, they create less than 1% or no factor at all. In my interview with Kaylee Tell, mother of a severe hemophiliac B boy, she says that these levels are so important to find out for the mother and child, because in mild cases, they really only have to worry about infusing or getting medication when they're doing major surgeries or have major injuries. In a moderate case, they only have to infuse once a week, even though that does seem like a lot, and they have to take extra precautions. In a severe hemophiliac, they have to do all the above, and they have to worry about joint bleeds, spontaneous joint bleeds, or spontaneous brain bleeds. and this affects their quality of life. And now that we know that there are 2 types of hemophilia, A and B, and that there are 3 different levels, mild, moderate, and severe for each one, we can talk about the different types of treatment. Now, while there is no cure for hemophilia, there are different treatments that they can do. They can get infused or infuse themselves with something called a prophylaxis. Prophylaxis is a daily or weekly infusion that helps your body clot blood because it is essentially concentrated factor, either factor 8 or factor 9, and it's given to the patient. Now, the World Hemophilia Federation reports that people using prophylaxis have less joint bleeds and better joints overall. But prophylaxis is usually only given to those in the severe cases. This medicine is made from donated plasma or genetically engineered cells. So it takes time, it takes money, it takes donations. So it's generally only given to those with severe. Another treatment coming is called gene therapy. And this is exciting because it's been studied in the UK and now studied in the US and is starting to become public use. The gene therapy is done when scientists place the factor 8 or 9 onto a harmless virus. They send it through the patient's bloodstream over and over again, essentially tricking the body into making its own factor. In December 2017, there was a report by Science magazine that gene therapy had a huge breakthrough. 10 men were tested, and out of those, 9 had 0 bleeding episodes for 18 months. Later in December, there was another report by Medical News Today, and they did another study where the results were outstanding. There were 13 patients tested, and all 13 were able to stop prior treatment. So though these are experimental and they are amazing results, they're not completely public yet. But having knowledge of it and understanding the disorder is bringing us much closer to finding a cure and ending this silent disorder. So now you know the 2 types of hemophilia, A and B, the different levels of severity, mild, moderate, and severe. And we know that it's caused by a genetic mutation from either the mother's X chromosome or a spontaneous mutation at birth. We are now aware of the missing factor and how it stops a person's blood from continuing the clotting process, but that with daily prophylaxis, patients can live a normal life. So something like traveling the world, surfing in the ocean, climbing a mountain, hiking through the forest, these are all dreams that you and I can achieve. But for someone like my nephew Henry, these are risks he might not be willing to take because of fear of a spontaneous joint bleed or an injury, and he's not close enough to a treatment center. So my dream is that someday all hemophiliacs will have a cure and they will be able to achieve any dreams they have without fear.